I know this is a really, I know this is, I know this is a really sensitive topic for some, and if for some reason it's becoming overwhelming to you, do what you need to do. If you need to step away and not be a part of this, that's fine. This is being recorded, so you'll be able to get a copy and listen to it or watch it at a more appropriate time for you. So take care of you, number one. That's number one. All righty, so let's dig in. I'm gonna share my screen and we'll get going here. And all right, so yes, today we are talking about suicide, and we definitely want this to be a discussion. I want to hear your thoughts as we go along. What we're going to be talking about today, we're going to be looking at some facts about suicide, also some of the warning signs, and then ways that we can help, and then also the issues that are faced by those left behind, because as in addition to grieving, as we'll see in the normal loss, there can be additional layers on top of that that are very difficult to deal with. So starting off with some facts, and I want to start off with facts because this topic and this issue has such stigma around it that people who have had a loved one who has died by suicide often feel really isolated and alone, like they're the only one, but they are not. And if that's you, you are not. As you can see here, over 44,000 people die every year from suicide. This is not a small number. And as you can see, over 20 years, from 1999 to 2019, it has increased over 33%. So it is on the rise. And to put that into perspective, one suicide every 11 minutes. So this is a very big issue, even though we don't hear a lot about it, or there's a lot of stigma around it, so people don't want to talk about it or share. If there's a likelihood that you know somebody who has been through this and you're not aware of it. It's as you can see, the second leading cause in 10 to 14-year-olds, the fourth leading cause in 35 to 44-year-olds, and the fifth leading cause in 45 to 54-year-olds. And it's not on there, but 55 to 64-year-olds, it's the eighth leading cause, which you think, oh, well, that's way down there. I mean, there are a lot of illnesses that come along as we get older, but that's still 8,540 people who committed suicide in a year who were aged 55 to 64. So even though it's the eighth leading cause in that age group, it's still a high number. And we do have groups of populations that are at a higher risk, and that includes the American Indians or Alaska Natives, non-Hispanic whites, veterans, people in a rural setting, which can be a little surprising. Oh, I have veterans on there twice, sorry about that. And certain industries such as mining and construction, and then the LGBTQ community. And there are a variety of reasons for all of these. A lot of them are economic, socioeconomic. Access to resources can be limited. And it's like on the parts of veterans, it can be a lot of PTSD, trauma. And in the LGBT community, they have additional stigma around being outside of what people consider the societal norm. So there's a lot of issues that they have to deal with that make it very hard and can lead to a lot of mental health issues from not being accepted often by the mainstream society. That being said, there are pockets with higher risk factors, but the truth is it affects all segments of society, regardless of race, religion, age, and socioeconomic status. It affects all segments of society. I need to move my bar here. Hang on just a second on my screen here. My bar is blocking.
And Kathleen, real quick,
Yeah.
there's one of the attendees that says she's having a problem hearing you, and I know I can hear you fine. Is there
Okay.
anyone else having any issues?
Let me turn my volume up a little bit more. I'm at 100 now. Is that any better?
Good on my end.
Anybody else?
Mhm.
I just want to make sure it's
Yeah,
not a
I think we're
problem.
okay.
Okay. Okay. So just kind of clarifying as we get going, language around suicide. So the definition is the death caused by injuring oneself with the intent to die. So that's the intent. So someone who maybe had an overdose but was not intending to die, with an accidental overdose, that would not be called a suicide. So there has to be that intent, which we don't always know, right? And then a suicide attempt is when someone harms themselves with any intent to end their life. And I need to move this screen too, because I can't see on my slide. Okay. Intend to end their life, but they do not die as a result of their actions. So there's an attempt to harm themselves with that intent. And then suicidal ideation refers to thinking about, considering, or planning suicide. And that can cover a whole range of thinking. So we may be thinking, it's not abnormal to think about suicide. Probably all of us have maybe thought about it at some time or another with situations that come up. But there's a difference between thinking about it, considering it, and then actually planning it. So think about it. If someone's thinking about it, so maybe they got a new diagnosis, a potentially life-limiting diagnosis. They might start to think, well, what would I do if such and such happened? Or if I was in this state, what would I do? And that's just thinking about it. And then if things progressed and got worse, then there might be actually considering it and thinking about it. Well, is this something I really would consider doing? And then the difference in planning is when we're creating a plan. Okay, maybe I'm going to stockpile some pills, or maybe I'm thinking about purchasing a gun, or how would I do that? So suicidal ideation kind of really runs the gamut, and that's why it's so important when we talk to someone to kind of clarify where they're at in thinking about it. Why is my slide? The other part to that is that words have power. And so the idea of suicide, as we know, has a lot of stigma in society, and there's a lot of judgment around it. And a lot of the words that we have used over time have kind of reflected that judgmental and stigmatizing attitude. So we say things like they've committed suicide, which, like you commit crimes. So in our mind, that we kind of equate those kinds of things. And we say things like it was a successful suicide. Well, that doesn't necessarily resonate super well either. Or a failed suicide attempt. So you've failed somehow, or completed suicide. So the language has been shifting a bit, and it's being replaced more with things like, and these are neutral, but they're kind of blunt. So death by suicide, or died by suicide, and suicide. And I'm curious what you all think. Do you have any thoughts around the words that we use in that? Or what do you use when you say, when you talk about someone having completed a suicide or attempted? Any thoughts on that? Anybody? Do we have anything, Adam?
Nope, nothing in the chat.
Okay. Okay. I particularly kind of like the shift in it. I do feel like it's a little less pejorative, but it's hard to change our language a lot. I still find myself saying things like committed suicide. I'm trying to consciously change my talk, but it takes a little time, a little bit of practice. So some of the warning signs, and as you'll see as we go through these, they can be really vague. Many are very vague. Very few are pretty specific. And so it makes sense a lot of times why when this happens, we look back and we say, oh, I had no idea. I had no idea what was happening with them, because a lot of these warning signs, they can apply to so many things and just general living. So let's look at some of them. This one, of course, is pretty specific, talking about wanting to die. That's pretty much saying, okay, this needs to be addressed, and looking for a way to kill oneself. So if you find that they're searching the internet for various ways, then we really know that that is something that they're really thinking about. But talking about having no reason to live, well, okay, they may feel that way, but that doesn't necessarily mean that they're thinking about suicide. I've talked to a lot of patients who talked about not having a reason to live or being okay with not being alive anymore. But they say, oh, I would never kill myself. It goes against my religion, or I don't want to cause that pain to my family. So that can be a little bit vague. Giving away prized possessions. This can definitely be a sign, but maybe not. Maybe someone's getting older. Maybe they have an illness and they know that time may be limited and they decide to give away those prized possessions. But it also could be a warning sign that they're starting to plan something. Here, very vague. Acting anxious and agitated. None of us ever do that, right?
Yeah.
So it can be a warning sign, but it could also just be normal living. Talking about being an unbearable pain. This can definitely be a warning sign, something to pay attention to. They're all things to pay attention to, but again, some are a little more specific than others. Here's another one, sleeping too little or too much. You know, sometimes we do. And but if someone is doing that and you're seeing, you know, several of these things happening concurrently, that would be even more of a sign that they might potentially be thinking about suicide. Withdrawing and feeling isolated. And whether or not they're thinking about suicide, when we're withdrawing and isolating ourselves, you know, it could be depression, but not suicidal. But regardless, that's something we want to talk with somebody about, to try to see if they're willing to get some help, because that's a serious issue. Increased alcohol or drug use. Definitely want to pay attention to that. Showing rage or seeking revenge. Displaying extreme mood swings. Again, that could be a warning sign for possible suicidal thoughts or not. Talking about being a burden. This is a big one too. People, especially when they're ill, they're frail, they don't want to be a burden to their family. And so they think, well, maybe I would be better off. You know, maybe my family would be better off if I weren't here and they could just live their lives. So if they're talking about feeling like a burden, you really definitely want to have that conversation with them about that. Exhibiting daring or risk-taking behavior. That could definitely be a warning sign. and lack of interest in future plans. Again, it could be a cause of depression, not necessarily suicidal thoughts, but it definitely could be. And I just keep making that point because I know so many people who, when something like this happens, they think, oh, well, I should have known, or I should have done something. I should have seen the warning signs, but I didn't see them. But so many of them are not like glaring, saying, I'm thinking about killing myself. But we often put that judgment on ourselves when we look back. Any thoughts on that?
Oh, we got a couple people that raised their hands.
Okay.
Brianna, did you have anything? Oh, let me unmute you. I see your hand is up.
Are you able to unmute her?
I can ask her to unmute.
And Lena.
Oh, okay. I think I figured out how to unmute myself.
Hi,
There's Brianna.
Hey, thanks for talking about this. I guess I've had a recent experience. Well, not recent, I would say 9 months. And it was, I feel like it was a lot in the moment related to probably alcohol. Is that a pretty high statistic for people who you wouldn't kind of expect that to happen, but it's related to alcohol and drug use?
Yeah, I don't know the exact numbers, but definitely, that can be definitely a warning sign that someone is thinking about that. And sometimes they are just so unhappy that they're doing whatever they're doing to take away the pain. Do you know in your particular circumstance whether it was intentional or whether it was accidental?
I guess it's kind of unknown, but she was intoxicated, so.
Right. So then you're kind of stuck with that unknown. Did she do this with intent, or was this just an accidental
Yeah.
thing? And a lot of times we just don't know, and that's harder because we wonder, but we may never know. We may never know.
It's very hard. Yeah.
It is. That happened to my next door neighbor. His son, who lived in Phoenix, was drinking a lot, apparently, like a whole weekend bender kind of thing, and got in the truck and drove, wound up driving into a wall and died. And so it's really hard to know, did he mean to do that, or was he just in pain and drinking too much and then made a not smart decision?
Yeah.
It's tough. And do you feel like you maybe kind of know in your gut, or you're just not sure?
I'm really not sure. I just think that the alcohol impacted the decision.
Yeah, and it really can, because if you think about it, when we do alcohol or drugs, and it reduces our inhibitions, right? Things we wouldn't normally do, we're more likely to do, if we're not thinking correctly, and we're down and we're sad and we think, well, this is the way out. We're definitely more likely to do it because we're less inhibited. So yeah.
Makes sense. Thank you.
Yeah, thank you. And Lena, if you can unmute yourself.
Mm.
Okay.
Ah,
Can you hear me? I
yes.
wanted to know, what about if you have like a young kid who keeps saying he's tired of his life and he's tired of living. How do you prevent that? You know, I have a friend whose son kept saying that, and he grew to his teen years. He was in high school. He was very active. He had lots of friends and everything. And then one day she came home and found him hanging in his room.
Oh, I'm so sorry to hear that. Yes, yes.
Prevent that when you hear it, but
Right. So was he saying that he was he was saying that he was unhappy and
yeah, with his life. But yet he was very popular. He participated in sports and everything. And
right, and that happens, and we hear about that on the news, right? Oh, so and so the star of the football team, and he was dating the cheerleader, and they just went to prom, and he committed suicide. What's that all about? And that's we just that we presume that that makes our life good, but it doesn't necessarily. It's more what's going on the inside that matters. And so really the way to kind of, I you know, whether we can prevent that or not, it's more like when people say things like that, we can't fix them because there's a lot of issues there. It's more reaching out and trying to get the professional help that they need. So if someone's saying that, we take it seriously. And we can't look at the external factors. We can't look and say, oh, well, they're popular and they're doing all these great things. They're you know, getting ready to go to college. And we're going to watch just a very short video here, the second one in a minute, and it'll kind of touch on what you were just saying. But yeah, the key really is to get that person connected with mental health resources because they're saying something. And you know, to the parent of that, the parents of that child, you know, I'm sure they were just doing the best that they could. We all don't know what to do sometimes.
Yeah.
They just probably thought he was fine, just going through a phase.
yeah,
Right.
that's what his mom thought.
Right.
And all of a sudden, you know, she found
Yeah.
it. That's sad. Thank you.
Yes. Thank you, Lena. All right. Yeah, it's really tough. It's really tough to know. And that's really one of the keys is that we just don't know what's going on inside of someone, even though their life can look perfect on the outside. It's what's on the inside that really matters. So thank you so much for sharing that personal story. I'm gonna go back here. Oh, yeah, so we're gonna watch two little very short videos. The first one is by somebody who attempted suicide and survived, and kind of her thoughts. And I had a couple of thoughts when I watched this, so we will watch this. It's only a few minutes. That's really loud. Sorry.
There's a lot of things that happen in your life that you can't choose. But the one thing that can never be taken away from you is your ability to choose how to respond. My name's Terry Wise, and I travel around the country. I do a lot of public speaking on mental health topics. So there was a lot of things brewing at the time. On Christmas morning of the year 2000, I swallowed 200 Percocets and 60 doses of morphine with a pint of gin. I felt like life was an endurance test for me, and making it to the next day and to the next day and to the next day was truly, it was just a fight for survival. I was home from the hospital and nobody knew what I had just gone through. So I was alone before the attempt, and now I was really alone. Well, I had been seeing Dr. Glazer. I went to her office with the hope that maybe there was some way she could help me tolerate being alive.
I think the key thing was not something specific I said, but I truly believed that together we could do the work and she could get better.
When you get to that point, you feel so worthless. And excuse me. to have someone believe in you that much. Suicide doesn't stand alone. It doesn't just happen as the result of nothing out of nowhere. It's the result of something. If you've gone through your life and you've had traumas or you've had difficulties or you've had things that you think you've buried, and then you have a significant loss or significant trauma occur later in your life, as I did with my husband dying, all the things that have been on simmer in your life come to a full boil. Suicide for me had become almost like a coping mechanism. And I learned in therapy that death wasn't the only way to end my pain. There were other ways to end my pain besides death. And one of them was developing coping skills and learning how to manage my feelings in a different way, which I did. There's one thing that everybody can do, and that is that they can always reach out for help. There's always somebody there that will offer support. Everybody's in a position to reach out for help and get support and not be alone with how they're feeling.
Oh, I'm sorry that was so loud. Hopefully you didn't blast your eardrums. Stop. Okay. Sorry. Hopefully I'll turn it down for the next one. But if you notice her talking, she's talking about being in unbearable pain and just wanting the pain to stop. When people have reached that point, they really, it's insular. They're not necessarily thinking about their loved ones or, their family, their friends. It's all insular because the pain is so great and they just want the pain to stop. And the other thing I wanted to mention about her video was she mentioned, feeling like life was an endurance test. She felt worthless. She's had trauma in her life. And I think most of us wind up with some trauma in our life. It winds up just being part of living, and it can be to varying degrees. But, and she didn't have great coping mechanisms, she mentioned. And as a loved one or a friend of someone who's going through this, with all of those things, we can't fix them. We can't make them feel better. It's really helping them if they're willing to connect with a professional who can help them. And so anyone who's feeling like, well, I should have been able to help pull them out of that or help them cope with it, it's greater than that. It's, we're not trained as just everyday people to help people out of worthlessness or over trauma or loss or all of those things, lifelong patterns that someone's had. So really, if we can be helpful, it's by being with them and then also helping them to reach out to the professional support that will help make things better for them. Any thoughts on that video before I show the other side, a suicide loss survivor?
Nothing in the chat so far.
Okay, I'm going to turn my volume down just a little bit. Here we go.
I do what I do because I actually lost my sister to suicide. When I was 21 years old, I was a senior in college, about a month away from graduating. And my older sister, whose name was Ren, who was 7 years older than me, took her life. And that changed my life forever. And I want to prevent other people from having the same thing. When we were growing up, my sister was like the be-all, end-all. I looked up to her. She was funny and smart and outgoing, and I had the cool older sister. I remember I used to hang out with her and her friends, and they would be like, your sister's so cute. She knows all the lyrics to Pink Floyd songs. But as she got older, she started really struggling with depression. and sort of the dynamic shifted. And I sort of became the older sibling in a way. She would call me when crying or upset. When she was depressed, she used to describe it as if she saw the world in gray, like there was no color. And when she died, she had moved to Maine and was getting her master's degree in geology. I talked to her 2 days before. She said she had a test coming up, and she was gonna, after the test, maybe go out with some friends, and she'd call me afterwards. And I called her the next day to see how the test was, and I couldn't get through. Her voicemail was full, and I found out later that my mother called me and told me that she had taken her life. After she died, we got her last phone bill, and she had called me 7 times that day, and I wasn't home. I didn't think about it till recently that she had called me 7 times that day, and what I do now is recruit crisis centers to a network so that people can call any time of day and get help. And I often think that if my sister had known that number and been able to call and been able to be connected with someone who could have empathized and supported and listened to her, I think that she could have made it another day. And I think we could have gotten through it. And unfortunately, that's not what happened. I know what suicide does to families. I know what it did to my family. No one in my family was ever the same. I say that my family died with my sister because the way that my family was will never be again. My mom is not the same person. I'm not the same person. My brother's not the same person. And I lost a sibling that I thought I was going to grow old with. I thought we were going to have a life and a future together, and suddenly she was gone. And that's so painful. And it's so painful to lose a loved one, but to lose a loved one by suicide is still so stigmatized. It's really hard to cope with that tragedy. People don't want to talk about it. People turn away from you. People avoid you. I don't want other people to go through that. And I think that people who are suicidal are ambivalent. Oftentimes, they are struggling with whether they want to live or whether they want to die. I mean, in the case of my sister, she called me 7 times that day. Why? I think that she was struggling. She knew she needed help. Unfortunately, that side won out, the dying side. But I think that she did want to live. I think most suicidal people do. And I think we just need to help her through that.
So kind of, Lena, to your point a few minutes ago, the sister, she was in college, she was getting her master's degree, she was going to go out with friends later. So everything on the outside looked okay. And she hadn't really shared with anybody until that day that she was so ambivalent, as the sister had said, like she wanted to live, but she was in so much pain that she also didn't want the pain and wanted to die. And so she was seesawing, and unfortunately, she reached out for help at that crisis point, and there wasn't anyone there. But yeah, so it can look so different on the outside from the inside. And I thought that was really interesting, that a great way to put it about ambivalence. It's, feeling I want to live, but I don't want to be in pain, and that seesaw. And at some point, it just tipped the scales to wanting to be out of pain. So, any thoughts on that video, or does it bring up any thoughts for you? Anybody? No.
Yeah, just a comment, powerful hearing her family died when she died.
Right. And the way she put it was so eloquent, because yes, she still had a family, but nothing was the same. It changed it for everybody. And I have really good friends, and they're like family to us. And their son was 22, I believe, and beautiful boy. And my friend came home one day, and he had shot himself in the head in the guest room. And yeah, family never the same. No. But again, it's like they're in so much pain, they're not necessarily not thinking outside of the pain. So how that would affect people, and maybe they think, well, I wouldn't be missed anyway, or maybe it's better off if I'm not around. I'm a burden, or any of those things. So it's really tough. So if anyone does reach out and just expresses in any way that they may be in a mental health crisis or having depression, the best thing we can do is to listen to them, which we'll talk about in a minute, and just try to encourage them and offer support around getting that professional mental health help. Oh, no. I will master this at some point. Okay. How to help. I gotta move my screen around again here. Okay. So we're going to cover just 5 action steps on how to help, what we can do. So number 1, just asking the question, are you thinking about suicide? And a lot of times we're afraid for 2 reasons. Number 1, that we'll plant that idea in their head if they weren't thinking about it. And number 2, if they say yes, you're like, okay, what do I do now? I'm not trained for this, right? So we get afraid to ask the question, but it's important to ask the question, and it's okay to ask the question because it does not plant the idea in their head. If they're thinking about it, they're already thinking about it. And if they're not thinking about it, you putting it in their head is, you're not going to be putting it into their head. What it does do is it shows that you're open to talking about it, about something that is taboo, about something that most people or many people have judgment about, that it's not normally safe to talk about. So you're opening that door to say, if you are, it's okay. It's okay to talk about it. And then because we're talking about it, we can allow for next steps in help. And some additional questions you can ask. If they say yes, you can ask, how do you hurt? Or how can I help? And they may not know, but it can start the conversation. So number 1 is just ask the question. It's okay. Oh, yes. The other very important thing is if you promise to do something when someone's in this situation. Oh, no. Well, sorry. Can't barely see my screen. This is number 1. Don't ever promise to keep it a secret. They may ask you to keep it a secret, and it's okay to say, I can't do that because your safety and you being here is that important to me that even if you get mad at me, we're going to work on getting you some help, and I'm going to let somebody know. So don't keep it a secret. And don't promise to keep it a secret. And do listen and take what they say seriously. Number 2, simple as be there. This is a known protective factor, and it helps to create them connected to something, and it limits that isolation. And being there can be physically, but it can also be over the phone or any other way that shows them support. So just being there in whatever form you're able to be. And then if you say you're going to do something, follow through with it and don't commit to anything you can't do. So maybe it'll be, something like, I'm going to look up some phone numbers for you, or I will take you here, or let me talk to so-and-so about it. Whatever it is you say you'll do, it's very important that you follow through. So if there's something you can't do, don't promise to do it. Just listen. They have shared something very personal and private with you. Opening up in that way is really scary for them because they don't know how it's going to be taken. So by just listening to them, you're giving them a gift. And then after you've listened, that opens the door then to talking about developing a plan, some steps that would be helpful for them. Who who do we need to tell in addition to me? And what's going to help you right now? What do we need to be doing? You know, that sister that was in the video that was in college, if she'd gotten a hold of her sister, maybe most helpful would be taking a break from college and saying, why don't we come home? Right? So just kind of what the situation is and talking with them about what would be most helpful. And number 3 is keep them safe. So number 1 is, have they done anything to try to kill themselves before talking to you? Do they call you up and say, I just took 100 Percocet? Okay, at that point, if that's the case, then of course, we're going to jump into emergency 911 and call. Okay, take care of the emergency first. And if they haven't done anything prior to the phone call or visiting you, we're going to keep them safe by learning. Do they have a plan? Is it, yeah, I'm thinking about, you know, stockpiling my medication, or I'm thinking about buying a gun, or whatever that might be. So do they have a plan? And then do they have a time frame? So yes, I'm stockpiling pills, but I'm not doing anything until my granddaughter's graduation, or I have an anniversary that's really hard for me coming up, and I'm thinking I'm going to do it on that day. So that helps to know, you know, are they just thinking in general terms, like I'm thinking about committing suicide? Or, see, I just did it, committing suicide. Am I thinking of dying by suicide? Or have I really thought it out? Is it detailed? And do I know when I'm going to do it? So each layer of these makes it more imminent and more serious. And then, of course, do they have immediate access? Yes, I've been stockpiling my pills for the last 3 months, and they're here. Or I have a gun in the house, and that's what I was thinking about doing. So those are some things to keep in mind. We want to keep them safe right now, immediately. And then we want to help them connect. So assuming this isn't an immediate crisis, okay, where we need to call 911, or they're thinking, I'm actively thinking about doing something right now today, which you would then call the suicide prevention hotline, which I have later in the slides. So if that's imminent, we want to take care of the immediate things. But presuming that this isn't something that's going to happen right now, we want to find out things like, are you already seeing a therapist or a counselor? Can we get you connected with them? We want to find some community resources, and I've listed just a couple here that I refer some of our patients to. Jewish Family Services, they do one-on-one therapy with people. They take Access. They also take the traditional Medicare, and they work on a sliding scale for cost. And then the Arizona Behavioral Health Clinic through the university, they have PhD psychology students that work with people, and they don't take insurance of any type. It's private pay, and I can't remember if it's $10 or $20 a session, but it's not that much if people can afford it. And we had a couple of them do time at the cancer center where I work, and they were really good. So community resources, connecting them, very important. And then we want to maybe help them develop a safety plan. So if you're, you know, kind of helping them to say, you know, if this starts to rise up, or, you know, you're starting to have these thoughts, what will you do? Who will you contact? So how do I know I'm feeling this way? And then as I am feeling that way, what will I do? Okay, well, I'm going to call Aunt Mary, and Aunt Mary's number is, and then if I can't reach Aunt Mary, I'm going to call Bob at this number, whatever plan it is. And when we work with patients, at the cancer center or pretty much mental health field in general, we'll do a safety plan where we write it out and then have them sign it and say, yes, I will not do anything to end my life until I have done these things. So it's an agreement that they make. You may not be able to do that as a friend or family member or a coworker, but you can at least talk them through making a plan, what they will do when things start to become overwhelming again. And then follow up, number 5. As simple as leave a message, send a text, give them a call, let them know that they're still on your radar, that you haven't dumped them, because it continues that feeling of connectedness. You were with them during a very difficult time. They've bared their soul to you. They've shared feelings that maybe they haven't shared with anybody. And we want to stay connected because we don't want them to feel abandoned. And it can be as simple as, a text, I was thinking about you today, or how you doing? Give them a call. Check in to see if there's more you can do to help them. And then you can also follow up. So say you said, oh, well, I will get you some phone numbers, but you haven't had a chance to do it yet. So just checking with them and letting them know, hey, I'm still going to do this, but I haven't had time. So just staying connected with them. Oh, we're running out of time. Let's see. Last 5 minutes, family, friends, and coworkers. So after someone has died by suicide, of course, we have the normal grief, right? But there are a lot of feelings that come up within that, or can come up, or a variety of these things. Of course, we have sadness, maybe confusion. How did this happen? Why? What? Like you were saying earlier, Lena, it doesn't make sense, right? So our brain is just very confused about why this happened, how this happened, and we just stay in that state of confusion. Denial. Denial can be a protective factor in the short term, not believing that this happened. But because the brain just can't handle it, but that needs to be a very short-term thing. If we're in denial farther, weeks or months later, that's definitely a time to get some help. We've definitely fear, anxiety, anger, shame can be a big one. Relief. You might feel relief, maybe this person has suffered with mental health issues their entire life and you've seen the pain that they're in. And in addition to all these things, you feel relief. Or maybe you were a caregiver of someone with a horrible illness, and you feel relief for them and you feel relief for yourself because of how difficult it was. There's also regret and feelings of guilt. I shoulda, coulda, woulda. And just know that these are all normal human feelings and they vary throughout the process. All of them, very normal. There's nothing wrong with you. And we do this. I'm going to go through this quickly and you'll have the slides if you want them. We do this thing with our brain. We take what we know now and we apply it to situations in the past. So, if only I'd gotten home 10 minutes earlier, or I should have known this, or I should have done that. But when we go back to those vague warning signs, that's really unfair. And so these are called cognitive distortions. It's distortions in our thinking where we apply blame to ourselves when it's really not our fault. And then possible additional issues for survivors. Maybe PTSD, because sometimes the death is violent and usually unexpected. Sometimes they have to deal with the police, or maybe ask if they want to visit the death scene. And if they have to choose in the moment, and sometimes it's the right decision and sometimes it's one that may be a little more traumatizing. And then of course there's the stigma around mental illness. And then family members may differ on we shouldn't say anything. We should say it was a suicide. We shouldn't say it was a suicide. And then sometimes the religion condemns suicide. And sometimes people get blamed or they blame themselves.
Hi, Kathleen.
Yeah.
I have a question from Brianna.
Sure.
And it's, my best friend died last year on Christmas Day. I am dreading this day. Any tips to help get through it?
Oh, goodness. I'm so sorry. Yes, the holidays are really hard, especially when now you associate it with that. Just with the brief time that we have is number one is honor however you feel that day. It's okay to have feelings, to be sad. A lot of people try to like pretend or put on a happy face or do things that they wouldn't want to do. Listen to your gut. If that day, even if you've been invited to family or friends and you don't want to go, you know that's going to cause you pain. Listen to yourself, number one. And the other thing is maybe, is there something you would like to do on that day to honor them or to remember them, a little ritual that you can include in the holiday that will be a little remembrance of them. And that's just a couple things off the top of my head. I hope that's helpful. And of course, we talked about having mixed emotions, a lot of them. So we can be angry, feel rejected, abandoned, and blame them, blame ourselves, but then also at the same time, have compassion and understand for what they were going through and the suffering that they had. So very mixed emotions. And then as we talked a little bit about why, we may never understand why, or even if it was. And so then our brain needs to fill it because we're meaning making machines. So if we don't have an answer, we fill it. If we don't know, so we say, I should have, or what if this, or what if that? And those are cognitive distortions, and just acknowledging them as such as say, oh, that's just my brain. It's just trying to make meaning out of something that just does not make sense. And it may never. And then I'll end on complicated grief, because people who have lost someone to suicide often have complicated grief because of all of the factors that we talked about. So troubling thoughts, of course, normal to have troubling thoughts after someone who has died, but if we're getting caught up in those kinds of thoughts that persist and stay with us throughout the day, or if we specifically try to avoid reminders of the loss, like I can't, if something happened in the garage, I just can't go into the garage. And difficulty managing painful emotions. Of course, we're going to have painful emotions and grief, but people with complicated grief are often unable to have that lesson over time. And my suggestion is, if someone has survived having a loved one die by suicide, whether it's complicated grief, which is if that's gone on for more than a month, after 6 months from the loss, even shortly after the loss, reaching out and getting support, I would recommend it as soon as possible, because this is such a difficult, multi-layered type of grief. And do we need to end, or shall I keep going? I have just a couple more slides.
You can keep going.
Okay, so just some helpful tips. So if you're dealing with someone, a loved one who has suffered a death by suicide, saying things like, I don't know what to say, but I'm here for you, can be really helpful, because really there's nothing we can say that can make them better, that can help them, Our job is not to make them feel better or be happy, but it's to be with them and be a witness with them as they go through it. So saying, I don't know what to say. I say that to patients all the time. I say, you know, or I wish I knew what to say. But I just don't know, but I'm here. And refrain from saying, I know what you're going through, because we don't. Every loss is different, whether it's suicide or not. And no matter how many common factors there are between you and the other person, it's different because our relationships are different, the time frame is different, so many factors. We just don't know what they're going through. Don't ask intrusive questions about how the person died. Take the lead from that person. Do they want to talk about how the actual death happened, and let them talk? And avoid pat advice and hurtful cliches. Things like, you know, they're in a better place, or it's God's will, or all of those things. And the person may even believe those things, but hearing it from someone else, it upsets people. And do not place value judgments on the suicide. Do not imply blame. Be proactive about offering help. Not only what do you need? Often people don't know what they need, but if you see a need, like, hey, why don't I, you know, take the kids overnight? Or do you want me to, I see you're getting all these phone calls. Do you want me to sit on the phone and screen your calls for you? If you look around and see how you can be helpful and offer it, sometimes that's better than just saying, how can I help? Because people don't know. And don't be afraid to talk about the person who died. So rather than focusing on, you know, the time of death, who were they as a person? You know, I remember when we went out to dinner that time and he told that silly joke, or she, you know, I always loved the way she did X, Y, or Z. So talk about the person and their life. Be patient. This is tough. It's going to take a long time, longer than you think, to be able to move forward. Don't disappear. We talked a little bit about that. Stay connected. People need that. And we all have busy lives, and we'll stop everything for a crisis, and then we get back to our lives. But, you know, once a month, you can give a phone call or invite to dinner, or just, like I said, send a text saying, hey, thinking about you today, or anything like that. Just stay connected. And then lastly, the various resources. So Suicide Prevention Lifeline is fantastic, especially if someone's in a crisis. We have the Veterans Crisis Line. For younger people, that crisis text line, that's a really neat thing. A lot of young people don't want to talk on the phone. You text to that number and you'll get connected with someone who will text with you. It's pretty cool. Impact, Survivors of Suicide. If you're a survivor of suicide, I would recommend connecting with them and their groups and their resources. And the Suicide Prevention Resource Center has great, so many resources available. And then a lot of people have mental health benefits through their insurance company. You can call your insurance card, but if not, Psychology Today, you can go to your local area and look at, like, Tucson. So there are so many therapists in Tucson listed on Psychology Today. Various prices, various types of counseling. And then this Take 5 to Save Lives has just information as well. And sorry I went over time.
That's okay. We started a few minutes late.
Okay. And if anyone has questions, or I'm happy to stay on afterwards if that's okay and you would like.
Do you have any of your contact information that you'd like to share?
Yes, and that's on the
There we
next
go.
page. Sorry. Very important, right?
Yes. Oh, I did have a question that popped up that I almost missed.
Oh, sure.
It's does knowing someone or being a relative of a person that takes their life, does that increase the risk of that person trying to do the same?
Yes, I'm so glad you asked that question because I meant to say that. Yes, if you're a family member of someone who had committed suicide, or you know somebody who committed suicide, it does increase your risk. Yes.
Wow.
Yes. Because then in our brain, for sometimes it's seen then as a viable option.
Hmm.
Yeah.
Great.
So glad you asked that.
Yeah, I'm glad I didn't miss that. I think that's it. I don't see any more comments or questions from anyone. That was a great presentation.
Well, thank you.
Very helpful.
So happy to be here, and thank you so much for inviting me. And yeah, thanks.
Thank you. And everyone has my email. If they have any questions, feel free to email me, and I'll post the recording shortly. Thanks.
All right, thank you.